sorry. How do you manage telling bad news? Because I know it's doctors or you too. I don't know.
Yeah, I don't generally have to tell patients bad news unless it's something like some issue that slipped by and they aren't okay to have surgery on a certain day, and we have to cancel their case the day of surgery. That's kind of the most frequent time where I have to give them some bad news. If there's a bad outcome, if there's some complication, something that happens during the operation that is unplanned, but which can happen, that's happens not frequently at all. But the best thing to do is to be honest about what happened, because bad outcomes can happen whether you did your job correctly. They can still complications can happen. That's just the nature of what we do. Thankfully, with the advent of technology like the monitoring and the drugs that we have today, those things are quite rare actually, but they do happen. And so yeah, you just have to be honest and communicative with the patients and their families.
I think you answered this one with the question you said, like, how do you prepare patients, which is like just telling them what you're going to be doing, right?
Yeah, correct. Consenting a patient for surgery and telling them what you're going to be doing is a pretty significant part of your day when you're first meeting the patient. Again, it's always good to be clear with what you're going to be doing. Informed consent means that the patient will know what their options are and what you'll encounter often is patients not essentially deferring to your judgment, like what would you do kind of a question, or what their approach to what they're having done. Yeah, that's just a normal part of your day, and again, just honest and straightforward is the best policy.
What's your favorite part of it? Is there someone you look up to in this job? Like professions that you see day to day that you look up to, or people in general?
There's a lot of people I've worked with over years that have my respect, which I suppose we'll be looking up to. Yeah, I look up to the people who, in a broad sense, in my field, who are vocal about doing things well and doing them according to the standards, and being willing to not get engaged in some of the pettiness that evolves out of the dynamics of us having essentially 3 different kinds of providers in anesthesia. Yeah, I have some colleagues I've worked with over the years that fit that bill. No one that's of any note that you like a household name in anesthesia. There's not any.
What's your favorite part about the job?
I think it's definitely just seeing the good outcomes and doing a good job from a technical standpoint, managing the patient so that they have a pleasant experience, that they are doing well, and we're well cared for.
Do you have any goals in this job, or is this just your goal? Or like in life?
Yeah, so I'm kind of winding down the career here in some respects. I'm not ready to hang it up. It depends on the work environment, but I might have another 10 years of work to put under my belt. For me, the goal for the last 10 years is to help bring more of a robust information technology support structure to our lives. The electronic healthcare records are very functional in doing what they do. That is recording data that the patients generate when they come to the hospital. They're not good at decision-making, support, relational database, gathering information. There's just some real clunky stuff that we, in the digital sense, that we have to deal with. And that's just, ever since the advent of mobile devices and touchscreens, it's just been I've been acutely aware that my daily life of interacting with the things that I need to do in my daily life are very different from an information technology standpoint than what we do in healthcare. And there's a huge space for improvement.
Like your goals, like make, I think this was called information. No, what was it called?
The electronic health record.
Yeah, the electronic health record is like more accessible and like more easy to use for other healthcare providers, right?
So here's an example. There's a company recently that I introduced to the health system, and in St. Luke's they have a department called the Emerging Technology Team. And the company, it has designed a third-party software application that will access the health information exchange, which is a digital kind of highway, if you will, that the government has mandated that all the electronic health record providers participate in. And this technology company will, their application will go and search a patient's record when they encounter the surgeon in the surgeon's office, when they are put on the schedule. That will trigger this application to go and query all of the information that they have available on the health information exchange and pull from that relevant diagnoses or medical problems that would be impactful to their anesthesia or surgery experience. So for instance, if a patient has a history of heart failure, it will note that, and then it will go looking for specific tests that will indicate whether the patient has controlled heart failure, it was a one-time event, it was chronic, what the status of it is, how bad it is. It will go and find all that information, which now is done by a human in a very difficult sort of manual process. Someone has to go and look for all these records. And when you get outside of the electronic health record ecosystem at your specific hospital, and you start trying to look for records that are, even if they're in the same electronic health records company's system, you still will have to go look for, we're going to go look at the records at Scripps in La Jolla, or we're going to go look at the records in Seattle. That's a very difficult process and very manual. And it seems ridiculous for me to be saying this to you in 2025 when you can, as a student, get on ChatGPT and pull data from anything and anywhere in the world and come up with answers or collate data. It's very difficult. It's very, and it makes for, that's the kind of stuff that makes our healthcare system here so much more expensive and so much more clunky and burdensome in many respects. And so, yeah, it should be, it should not be a surprise to anybody, but it is, because these systems live in isolation and only the people are using them are healthcare providers. And yeah, there's a lot of us, but we've got pulmonologists and nephrologists and anesthesiologists and surgeons and all kinds of different people, and they have different motivations, and nobody really has the time to deal with the issues that are on this kind of a macro level. And so when I found out about this company, I was interested in presenting it to our health system, because it could help us be more efficient, bring more safety and quality to the patients, and it's an AI-driven tool that will help you with not necessarily clinical decision making, but at least help you understand and risk stratify your patients on a little bit more of a coherent basis.
Like I know there's records in different areas, like I used to live in Texas, so there's probably records out there, but I thought it was like all, once you transfer or move somewhere, I thought like all the records go to like the nearest hospital.
No, there's about a handful of big electronic health record providers. The biggest one is called Epic Systems, and then after that it's Cerner, which recently got bought out by Oracle. There's Meditech, there's Provation. So yeah, there's a lot. Yeah.
Do you wish for more? Like more knowledge, or would you like to go higher up in like the medical, like how to say the roles in healthcare?
No, the only thing that if I decide I don't want to ever get called and woken up in the middle of the night because I'm on call, doing something in more of a administrative basis, or like I said, in the technology realm would be appealing to me. But in terms of like getting my DNAP or anything like that, no, not interested.
What are the biggest challenges here? Just like turning out this on and with the machine on and like not having something.
Specifically here, I think the biggest challenges are just bigger technical issues that I described. Yeah, it's just and that's not something that's specific to St. Luke's. As I mentioned, this is a very well-run system, probably one of the best I've worked in. I'm grateful for that. But yeah, just the
information processing.
Yeah, evaluating patients and correctly triaging them or correctly assessing their surgical risk. But on the scale of challenges that I face in my career, this is very low.
How do you feel about needles?
What's needles?
How do you feel about needles? Because I know you're around them almost every day.
Needles are great because most of the time they're not pointed towards me. But with the advent of some of the sedating drugs that we have that can help patients, the way I phrase it to the patient when they're going to get a nerve block or something that I'm going to do means I'm going to poke them with a needle, is I'm going to give them medicine that's going to make them not care that I'm going to poke them with a needle. So.
I think I already said this earlier, but on camera. What education did you go through to get where you are today?
Yeah. So as we were speaking before you started your recording, I graduated high school, and 2 months later I was in a licensed practical nursing program. That was an 11-month program. It was great because it not only gave me an introduction to all the anatomy, physiology, but just nursing in general. And then it also gave me a way to pay for school as I went through college, which was, a better. That was the only way I could do it, and I didn't have to get jobs, in food service and things of that, or whatever that didn't pay as much. I mean, still, I think when I first started as an LPN, I was making $3.75 an hour or something like that, but it paid my bills, and it made it so that I could go through college. But it also gave me exposure to all the material, and then the path to have clinical experience to match those two things, so that the academics weren't disconnected from pragmatic, real-world application. And I think that's super valuable, and is a smart thing for you to do, is to start with, get your CNA license, progress through, take the jobs that will be most fitting and give you the most experience. Like if you could get a job in an emergency room, for instance. That's where I worked predominantly for 6 years before I graduated with my bachelor's. And it was a huge learning experience because I got to see all kinds of different cases. I got lots of different experiences, and that was extremely helpful as I then transitioned into critical care and then anesthesia training.
I had a question about that, because is it true, because nowadays Is it true that like if you have like one C or if you get like below like a 78 in class around there, like they drop you out of the program or like yeah.
In undergrad or?
I think like in anesthesia school when you're going through there. And then also I also heard that like nursing schools, like all the assignments and everything you have to get higher than like a certain score else you get dropped from the nursing program.
Yeah, I don't know specifically about all those, like all the different programs, but I'm trying to think back if there were any like cut and dried requirements like that. But here's the way I would approach that. Like I remember going through nursing school and somebody, occasionally a classmate would raise their hands and ask the teacher if something was going to be on the test. Wrong question. Don't ever ask that question. Your approach to this should be that I want to learn everything I possibly can. Why? Because then when you're in this room, you're not going to be feeling as though you don't know what to do when the stressful situation occurs. Just say, man, I'm going to learn this stuff. And I'm not going to go, oh, I'm just going to pass it. No, I'm going to learn it. Don't focus on getting an A, focus on learning stuff that's going to help you take care of patients. And the grades will take care of themselves. Absolutely guarantee you that. Focus on, and if you're having trouble with a topic or a subject, go back to square one. You can find somebody to, like when I was in high school, I wasn't serious about anything. I wasn't doing what you're doing. And so then when I went to college, I wasn't prepared for advanced mathematics. So I had to start back and get a tutor and get, like, okay, I know I can learn this, but I didn't get all the basics down when I needed to. So I'm gonna start at square one, because if you try to start at square 25, you're gonna feel lost and you're gonna flounder. So if there are things that say, okay, this is kicking my butt, go back to square one and start at the basics, and you'll get it, because your desire, if your desire is to say, hey, I need to know these things, because I'm going to, you never know what piece of information is going to come in handy. You go, oh yeah, I remember learning that way back in, whatever, and it's there in your tool belt, like a piece of knowledge that you just are going to need to pull from. And it'll happen over and over in your career when you do this. You're like, oh yeah, I'm glad I paid attention.
What's worrying me more is just mathematics. I'm bad at math.
Well, the only reason you're bad at something, this is my theory, well, actually it's more than a theory. The only reason you're bad at it is because you didn't have the foundation, and when you were learning the foundation, you didn't have any motivation to learn it. Or you didn't have the structure in place. You were distracted. There was something going on in your life. There was, pressure. There was, you felt like, I'm behind the curve or whatever. Go back to square one. Get yourself squared away with the things that are going on in your life, so that those things are not distracting you from, learning. Surround yourself with people who are going to support that journey to the best of your ability, family, friends, whoever it is. And don't tell yourself anymore you're not good at something. Start telling yourself, no, I just don't know what I need to know yet. Because it's mathematics, we're not talking about learning differential equations and advanced calculus and things like that. Yeah, those are challenging things, but you can't get there from taking high school math and then jump into it. If you want to do that, you have to start building, and you're going to need to do basically algebra and statistics. Statistics is they're challenging in college, but they're not insurmountable, because I was like you, I thought, oh, I'm not good at math. And I said, no, you're capable of learning. It's like any other topic. And you need to just, if you're struggling, start with the basics, go through the reps. I remember when I was in college, I would get out of college algebra and I went straight to a study cubicle and I started working on all the problems, because all the stuff the teacher just told me was fresh in my mind. And so develop those skills where you're going to succeed because put yourself in the place where you can succeed. Because those are the reasons that you'll fail, is because you were distracted, you didn't have time, it wasn't a good, the teacher maybe wasn't the best, or you kind of got lost on a topic or a subject or a part of it, and you got behind. That's what happened to me when I was in high school. And so I had to kind of just go, okay, I got to retool, because this is what I want to do. In order to do that, I have to get this under my belt.
I think the last one. What's your advice? What is your advice to those who wish to be in your position?
Well, pretty much what I just said. I think school is challenging no matter what you do, and you should set about the goal of in mind and have a clear-eyed vision of what that is, and the decisions that you're articulating to me, like, oh, okay, well, should I do this, or should I be AA, or a CRNA, or an anesthesiologist? Those are good things to work out and start at, so you're off to on the right foot, and then doing this, talking to people who have the experience, but begin to evaluate the things in your life that are part of your journey, finances and support, and where to go to school. And I started out in LPN school, then I went to community college, then I went to University of Kansas and graduated from there. And then I went to a very little known anesthesia training program in Kansas City. It was super cheap. It was a great education. And I made the same pay that the guy who went to Duke and paid 10 times what I paid for my education. We make the same thing, and we know the same things. Now, are there differences? Yeah. Is there some cred if you go to anesthesia school at Duke, or at whatever school has notoriety? But it's not important in your career in terms of accolades for doing something, unless you're going to be an educator or something like that. Then yeah, maybe consider those places to give you a little bit more of a taste of an academic research-based program. But I learned very pragmatic. I finished anesthesia training and felt like, yeah, I can go out there and do what I need to do. So start looking at all that stuff and set yourself up for success, and don't necessarily choose the schools that are that have the biggest names or the most notoriety, because you can get a good education and not have to put so much pressure on yourself financially, and then feel that when you finish training as well, because that's a big issue these days. It's gotten way more expensive.
What kind of struggling right now? Because even though I'm barely a sophomore, I know junior year about to take SAT, and that usually determines what schools I'm going to get into, the school I'm trying to go to, very deeply in that, University of Utah, University of Oregon, Boise State, and I'm thinking of CSI too, just for 2 years and transfer. But the reason I'm doing those big schools is not because, like you said, the recognition. Because I know either way, I'm gonna be a nurse. I'm gonna be the same as a nurse that I went to community college. Sure. But it's mostly just the opportunities that are there. Even though I want to be a nurse, I also want to study abroad or something like that. But I know it's gonna be hard. A while back, I was looking into nursing, University of Utah nursing program, studying abroad, in which I think it was second year before you do clinicals. You can do it, but it's very hard because you have pharmacology, like you said, anatomy and all that. No, not classroom labs. But I was already thinking how I don't know if I'm gonna be able to. If not, still.
Yeah, those are great questions. Like I said, you're off to a good start, because I didn't necessarily plan my path the way I did, but it worked out very well for me, and I'm grateful for that. Because I didn't, I finished school and I didn't have a lot of debt, but I would evaluate those programs and look at is there, okay, when you take the ACT, you're looking for a way into college, right? You can't just completely flame out on that. And I forget what my ACT score was, but you know, I wasn't like crushing it. I wasn't going to get into Stanford or Harvard, but I got into community college. And when I was in community college, I essentially had a 4.0. So that then allowed me, I don't think I ever even had to submit my ACT scores when I transferred into the program at University of Kansas. What they looked at is my college record. So when you get there, you know, be serious about studying and doing what you need to be doing. And you know, there's been books written. I think Malcolm Gladwell wrote a book specifically about how to, you know, looking at what students succeed at bigger schools and which ones do better at just a smaller school. But look at that as maybe a progression and say, okay, yeah, I could maybe start at a community college and then just matriculate into the nursing program. And most of the nursing schools will have those structures set up, so you can talk to the counselors at the community colleges or at the smaller colleges and see. I think that's a huge thing. Go to the school counselors, get ironed out exactly what classes you need to take, exactly what the timetable is, exactly what you need to do to go from, you know, your freshman, sophomore year in college to because nursing is basically junior, senior year, but you got to have all the core courses to get into the program. Even if you're at the school, you know, if you went to Boise State, you'd still have to take all the first 2 year classes to get accepted into the nursing program. So, yeah, get all that worked out in your plan and make, you know, the connections there. And once you get going, you know, if let's say you know, you're like, okay, well, I didn't get the greatest at ACT. Well, okay, start somewhere where you can, you know, get the CNA, start getting your basic classes taken, getting them done. I got one of the best educations at a community college you could ever have, I think, because I had all my professors were PhDs. I had a little community college in a suburb of Kansas City, and it was like $25 a credit hour. You know, it was crazy. And so, you know, there are opportunities out there like that. And so, yeah, it'll, as you, like I said, you've got such a head start because you're asking these questions. So be confident in that. And yeah, I mean, they're not giving educations away for free these days, but you can make it so that you're not going to strap yourself down with a bunch of debt, and then, well, an exorbitant amount of debt. You probably will have debt when you finish, like I did, but yeah, it's just you can maximize that process by being willing to look at some of these pathways as not necessarily like, yeah, I need to just go to this big school. Because if you start at the junior college and you're able to transfer, you're going to get the experience. Because it was great experience at the University of Kansas. It's a huge hospital. It's tons of stuff, all kinds of different patients.
Would you ever recommend Kansas? Like University of Kansas?
It's a great nursing school. It is, and then the program that I did my training at is in Kansas City as well. Truman Medical Center, affiliated with the University of Missouri. Both great training programs, and that's the other thing too. Is you know, I'm happy to facilitate introductions to those specific schools for you, but you can also yeah, just ask people where they went. Kansas City is a very affordable place to live. You know, if you don't have family there and you're just moving there out of the blue, it could be a little rough, especially if you grew up in a small town, because it's a big city and, you know, it's just different. But yeah, there are places like that. But if you're, you know, if your core base of support, your family, your friends, and that kind of thing are here, it is a little bit bigger issue to move. And I had the support in Kansas City that I needed. So.
Because, like, I'm like stuck between Boise because my family, but then again, I know if I want to like do what you want to like what you are doing right now, like I'm gonna have to make some sacrifice. Like I'm gonna be missing birthdays, family events, and all that, which is hard, but later on it's worth it, I guess.
Yeah. Yeah, and I guess as of now, Idaho doesn't have a CRNA program, but
Oh, you're registered as a what's it called? Advanced nurse or something, right? Advanced ANNA. No, it's the Anesthesia Association.
oh, AANA,
Yeah, like
anesthesiast or American Association of Nurse
Yeah.
Anesthetists.
that's. I'm thinking about like it's because in Idaho, like the role of CRNA doesn't really exist. I guess it does, but like they're not seen as one, I guess. Isn't it? Aren't you guys registered with the advanced nursing?
Like an APRN,
Yeah,
Advanced
yeah.
Practice Registered Nurse.
Yeah.
Well, you are in every state. That's just sort of how you're categorized, because there are nurse practitioners, nurse midwives, and CRNAs. Those are the three big categories. So in Idaho, we are that, even though there's no training program here. And Idaho is what's considered an opt-out state, so you don't need any. Well, it's a very technical issue, but yeah, here you can practice to full scope of your license.
Oh. Okay, yeah, it's more fun because we had like a research project for the career that's in all this. Okay, this is interesting.
Yeah, there's a lot of stuff to learn.
Well, that's like all the